All right, let's jump into these segments. So yeah, I love technology. I love new stuff. Sometimes I wonder if new products have a place, and this is kind of the case with this segment. So we're going to talk about Alloclae, which is an injectable cadaver fat graft.
Dead people's fat.
Dead people's fat. Would you have a dead person's fat injected into you?
No.
I feel like that's like the beginning of a zombie
It sounds like some zombie
movie.
So I actually think that this is a pretty cool product, but there is one problem with it, which we'll get to. So what is this?
It's
so
gross. That's the one problem.
I look at that because we use cadaver products a lot in surgery. Like we'll use cadaver skin for various things. I mean, there's all sorts of cadaver products that are used in medicine that you probably don't even know about. So like I look at that, I'm like, okay, it's human harvested, so what? It's not like they're snatching people off the streets for this. I mean, it's sourced very ethically and legally and all that, so fine. Okay, so what is this? So this is a non-surgical fat filler that's off the shelf, which means basically it comes in a package and you just open it, which is sterilized donor or cadaver fat material. And it allows you to do fat injection without the need for liposuction, right? Because we've talked about fat grafting. You guys know what fat grafting is, right? You harvest fat from one area and then you process it and you inject it back in the body. The most painless of which is my least favorite surgery ever, Brazilian butt lift.
Yeah.
That's fat grafting. I use fat grafting for a few things, mostly for reconstruction, sometimes for cosmetic for breast. Fat grafting's fairly popular. It gets probably a lot more exposure than it actually happens. As much as you see about Brazilian butt lifts, they're done much less frequently than most other plastic surgeries. But this is a alternative to either traditional fat grafting or even fillers. Sometimes people use fillers for their face. Sometimes people use fat grafting for their face. So this is an alternative. And the advantages of it's non-surgical, right? Because if you're not doing liposuction, then you don't have to go to surgery.
Yes.
Right? So you could basically get fat grafting without having to have surgery, which is, I guess, a plus. Yeah. But then also, one of the issues I've always had with fat grafting is you'll get people that come in and say, I want to have fat grafting, and you look at them and they don't have any fat on them.
Yeah.
They're too skinny. So this does kind of fill that void where if somebody wanted to have fat grafting, but they just don't have any extra fat.
Yeah, like a skinny mini wanting a Brazilian butt lift.
Exactly, right? Yeah. Okay, so there are some advantages to it. Disadvantages, well, it does cut out the liposuction, which for some people is a downside because that's one of the nice things about fat grafting. It's like a twofer.
Yeah.
You lose fat you don't want, and it gets put somewhere you do want it.
Yeah.
And so if you go this route of using the cadaver fat, then you avoid that. But the other big disadvantage, which I'm going to talk about, is cost. Is this actually feasible to do for what it costs? Because that was my very first question. In fact, we had somebody come by our office with a fat, injectable cadaver fat. I can't remember if it was Alloclae or the other company that's out there. And that was the first thing I asked, like, how much does this cost? Because it's going to be expensive.
Yeah.
And it will be cost prohibitive. So how is this obtained? Well, cadaver donors have their fat harvested. The fat's refined and is purified, but it does retain all the growth factors, collagen, and protein, which are things that you want. Mm-hmm. It's then now, by the way, all of this is done by FDA standards, so this is a legit product.
You can't find it at Home Depot.
You can't find it at Home Depot. I mean, that would be really weird, but no.
I know, but...
But this is a legit product. A lot of times these products, especially more like wellness products, are not done by FDA regulation and standards. And so there's always that question of, was this really properly harvested or processed? You don't really know because no one's overlooking to see. But this FDA standard. All the donors are screened for communicable diseases, so like HIV, hepatitis B, Hep C, syphilis, those type of things, because you don't obviously want to get some terrible disease from your fat injection. It's then sterilized by gamma radiation, right? So they don't want any bacteria in it, so they sterilize it. And then it's sent out in these syringes, and the syringes come in 12.5 and 25 cc's. I think I put a picture in there, Brenda, of just the syringes to show what it looks like. Yeah, there it is. It almost looks kind of neon green. That might be the color of the TV. It looks kind of a weird color there. Does it?
Yeah, it's more yellow on my end.
Oh, it's more yellow. Mm-hmm. And in here it's kind of green. Okay, well, it does actually look like fat.
Looks radioactive.
And so, like, you know, when you look at the volume of these syringes, because, I mean, you guys probably look at this and, like, is this a lot or a little? So compared to fillers, it actually is a lot, because most fillers, such as Restylane and Juvederm, come in vials that are only 1 cc. Like, when we're injecting lips, if you're getting 1 vial, it's 1 cc. It's very little.
But, like, whenever you inject fat, doesn't that, like, absorb back into your skin?
Yeah, it does.
And it doesn't last into your body. It doesn't, like, last as long. Yeah, into your body.
Sort of. You're on the right track. So when you inject fat, unlike filler, which when you inject filler, like, yeah, when you inject filler, like, your body's not going to do, like, a sudden reabsorption. Whatever you inject is going to stay, but then over time it gets broken down. With fat grafting, it's kind of the opposite. You inject it, and some of it will go away. It doesn't, you never get 100% take, but what does take stays. It doesn't go away over time. Because that's the thing with lip filler and cheek filler, you know, the kind of the classic versions is you inject them, and then a year and a half down the road, they're gone. And that's why fat grafting has gained some popularity with the, you know, the cosmetic industry, is because once you inject it, as long as everything goes okay, it doesn't go away. It's there.
So do you, like, have to, like, kind of overfill whenever?
Yeah, that's really typical. If you're doing, yeah, that's exactly right, Sarah. So when you're fat grafting, you do overfill because you expect you're going to lose a small percentage of it. And so under ideal conditions, if everything goes perfect, you lose 20%.
Okay.
80% stays.
And then, like, for, like, in your face, people usually get it, like, in their cheeks or their lips or something?
I don't think they're doing fat injections in the lip. It's mostly cheek and just contouring. Just, like, as we age, you know, it's commonly done with facelifts. And I don't really like fat grafting on the face, and I don't do it, but, I mean, it's done pretty commonly. But, yeah, it's done to fix contours. Like, you inject the fat, and then, of course, you lose a little bit. So you might overfill it, but then whatever stays. So,
maybe that's what happened to Madonna.
I think Madonna got classic filler. I don't think she got fat grafting. Because if she got fat grafting, it wouldn't have gone away, and it did. It kind of calmed down.
This kind of reminds me, I don't know if y'all saw it, but it was this lady that got hair, like extensions or something, and it was hair from a dead body, and she got maggots on her head.
Oh,
it was like
gosh.
Yeah, I think it was on, like, I don't know. There's probably an article on it.
That probably was not FDA.
Yeah, it was a whole lawsuit. And she was like, it's itchy, and then it was maggots.
Oh my gosh, that sounds just...
Yeah, I was just like thought of that whenever you said coming from a dead body. I was like, oh my god.
I had times when I was working at the big trauma centers where patients would come in and they had maggots, like in a wound or something. That's, like, very unsettling. Yeah, I've seen that.
So gross.
I've seen it 2 or 3 times.
Gosh.
Yeah, it's a lot of times.
It's like a fear of mine.
Oftentimes it'll be like somebody that's homeless, you know. Like, they get a wound and then, like, they're not caring for it. Yeah,
I would, if I saw that, I'd be like, burn it.
Yeah, burn it with fire. Okay, so how is
horrible.
So if you want to get this fat injection, how does it work? Well, it's non-surgical. It's done under the office. It does have to be done by a licensed medical professional, which that varies from state to state. It has to be a doctor, or can it be a nurse practitioner? So you get numbed up. They inject the fat. It's actually pretty simple to do. It's almost like injecting filler. About 24 to 48 hours after you inject it, the stem cells of your body start to get into the fat and start to kind of incorporate it. By 2 weeks, the fat has matured, and by 4 weeks, the fat cells are definitely integrating into the host cell tissues, and by 6 months, there's stable results with all of the fat being integrated, and that's kind of your final result. So who's going to use this product? So it's used for certain things. So age-related fat loss. So we talked about people that get older and their face hollows out. This would be potential use of it. They said body contouring. So that'd be if, like, you had asymmetries to your body at certain points. You could use the fat grafting to kind of even it out, or use it for enhancement. Like, if you wanted to get a little bit fuller breast, you can use it for that. I have actually done fat grafting, classic fat grafting from liposuction on the breast a time or two. There are times when that's useful. So breast augmentation, hip dips, if you got, like, a little contour in your hip you don't like. If you go and get liposuction and something goes wrong and there's, like, a hollow space, you could use this product for that. Cellulite dimples, or basically anywhere where you have volume deficiencies. So there are uses for this. So that it's like, okay, product exists, there is a use. Okay, good. So then what are the risks? Really pretty small. Pain, swelling, infection is always a risk. You know, reabsorption, like you mentioned. I didn't notice, and I'm going to have to do a little bit deeper dive on this, if there's been any reported cases of the fat embolism, Because when we talk about Brazilian butt lifts and people dying, it's generally due to the fat getting into the bloodstream.
Right.
So I wonder if this product has had any of that. I didn't see any mention, but I didn't pull all the studies on
It'd
it.
be cool if there was like a lower risk associated.
Yeah,
with
right?
it.
Yeah, exactly. Yeah, and I'll tell you why the risk is probably low, because although you could enhance a butt with this, I don't think anyone's doing that. Although I do have a before and after of.
Well, you wouldn't think anybody be sticking like Home Depot supplies in their butt, but they do.
That. So who's the best? Who's the best candidate for something like this? Oh wait. Oh, so Brennan. All right, Brennan jumped in.
There's a butt.
So this is off a webpage that was advertising Alloclae results, and I look at that and I'm like, it looks pretty good. I mean, but I honestly am questioning.
She could have gotten those results by just doing squats, but
yeah, but that takes work.
I know. But still.
I honestly question if this.
Squats are cheaper.
They are cheaper.
They
So,
do be
Brenna,
cheaper.
you hit the nail on the head. I question if this is real. And I'm not going to call out like whatever place I pulled this from, but I honestly question if this is a real example of a before and after of Alloclae, which is the cadaver fat, because let's break down the cost. And this is where it gets, where I think it's not going to be something that's used a lot. A 12.5 cc vial, the ones that we showed on the camera, are $4,000 a piece. 4,000. 25 cc's, 6,000, 50 cc's, 10,000, 100 cc's, $18,000.
So that girl probably has like a $20,000 butt.
Way more than that.
Really?
If that was really from this product and they paid for that, which maybe they got it as sample just to get a before and after out there, in order to augment a butt, you're typically looking at like 400 cc's per side as kind of like the bottom, like the minimum. That's 800 cc's because you got to do both sides. You're then looking at like $150,000 worth of product. Like, it's not sustainable. Think about something smaller like a breast augmentation. If you're doing a really small augmentation on someone, that would be like 250 cc's for an implant, 500 cc totals. That's like a little less than $100,000. Like, this is not sustainable for doing large volume replacement. So what does that mean? Well, the only people that are going to do it are either people that have just infinite money, or people who just want like a really small,
Said the Kardashians.
Yeah, the Kardashians. Either that or just people who want like a really small augmentation. So for example, if you wanted to be, let's say something manageable, like if you want to go up a quarter of a cup size, okay, that's roughly 50 cc's. You need both breasts, so that's 100 cc's. You're looking at $18,000 to do a quarter cup size increase. Like, yeah, right? Like nobody's going to do that. I don't think. I don't think people are going to do that. I don't think I could get my patients to pay $20,000 for a quarter cup size breast augmentation. Yeah, I just don't see it happening.
No.
So I do think that the product is good.
It's just not there yet.
It's too expensive.
It's kind of like when they first came out with cell phones, when all the cell phones cost $18,000.
Right. Maybe as like it, time goes on, it'll get better and it'll get cheaper. I think the product is good. I do like it, but look at it. It's just cost.
Yeah.
Like if it's too expensive, no one's going to do it.
Yeah, it's not marketable yet.